Hi, everybody. I'm April Cummings, and joining me right now is Dr. Anita Johnson from Cancer Treatment Centers of America. And she's kindly agreed to talk to us today about issues related to breast cancer. Thank you so much for being here.
Thank you for having me.
Let's talk a little bit about the subject at hand. What do you think is important for people to know?
What's most important about breast cancer is that breast cancer treatment has evolved. About when I started being a breast surgeon about 20 years ago, most women were having mastectomies. So what we know today is that when you have disease in only one part of your breast, that you're a great candidate to keep your breast. And so we offer women lumpectomies. With the addition of radiation therapy, we know that it is equal to you having a mastectomy. So treatment guidelines have changed. Not all women need to have chemotherapy. Those that do, we really work hard on treating the side effects.
So some of the prior treatments may have scared people away sometimes, just from even finding out where they stood health-wise. Do you think that this will help people maybe come forward more earlier?
That is my hope. The more that women are informed, that's why we encourage them to get their mammograms at the appropriate age, which is 40 years old, because early detection counts. If you're detected at an earlier stage, you have better options in most cases. In some cases, we're able to do all of the treatment, the majority of the treatment in one day. Some women, they can get a lumpectomy. If their lymph nodes are negative at the time of surgery, we actually do the radiation then and there on the table. And it does, depend on their tumor profile, but those are some of the changes that have come about in the recent years.
So maybe less fear.
Less fear.
Greater opportunity to just come in the room earlier and get seen.
And that is very important. Continue to do your breast exams. I'm a huge believer of that. Most women who are diagnosed with breast cancer, they actually discover their own lump. So I still encourage you to do your monthly breast exams.
What else do you think it's important for people to know about kind of where we are, what the right things are to do at this stage?
One thing is, just know your body and know your family history is important. Most women who have breast cancer actually don't have a family history, but those who have a strong family history of breast, ovarian cancer, or prostate cancer, they're predisposed to being at higher risk for breast cancer.
So one of the reasons that you're here actually is to work with some of the medical professionals in Cayman and sort of bring them, kind of up to speed with what some of the changes are that have been going on. What kinds of things did you share with them?
As far as I am a breast cancer surgeon, so what has come about, over the past decade is that the surgical options have changed. We work closely trying to get a great cosmetic outcome as well as making our patients cancer-free. So the term for that is oncoplastic surgery. Say, for instance, a patient is having a lumpectomy. Sometimes we can offer them a hidden scar type of surgery. If they're in need of a mastectomy, some patients, not all, can have what we call a total skin sparing mastectomy, where we keep all the skin, including the nipple, and then the plastic surgeon comes in and performs the reconstruction.
How important in your view is it it just seems like not too long ago the cosmetic component of this wasn't considered as important.
Right.
But to the psyche,
Right.
I would
It's
want...
very important.
Yeah.
It's very important for me, for my patients, but for me as a woman surgeon, it makes me feel better at the end of the case, that it's nice, that I know when she looks in the mirror that she'll be comfortable. Because one of the greatest fears is not just having breast cancer, but being disfigured. Several decades ago, women went with mastectomies without reconstruction. Some still walk in today without even a prosthesis. And most patients today can have reconstruction done at the same time of surgery after their mastectomy.
I mean, not that anything makes it easier, but
Right.
I can see that that might improve also how you feel afterwards.
Exactly.
And help you focus more on healing
Exactly.
and less on sort of that emotional strain.
Exactly.
Thank you so much for talking with us. Is there anything else you want to share with folks before we go?
As I discussed, know your family history. Breast cancer treatment actually starts just knowing your family history, knowing if you're high risk or not. At our facility, we offer, genetic testing, which is important, as well as we screen women to see if they're high risk. So get your mammograms starting at the age of 40 and every year after that.
Thank you so much for talking to us.
Thank you.